I would say that I do see a lot of acid reflux and gastritis in my clinic. However, there are cases of irritable bowel syndrome and also inflammatory bowel disease, but they are much rarer. Usually, we do see a lot of gastritis or also gastroesophageal reflux disease, and they will come with multiple symptoms and multiple presentation. Yeah, well, IBS and IBD are not that common. If I may start with acid reflux or gastritis, the patient may present with heartburn, they have this nausea or vomiting, and they can also have upper abdominal pain, centrally located. Usually, they will try to get treatment from clinic, but they do not get a resolution of symptoms, and they will present to the clinic with that symptoms. However, with irritable bowel syndrome, they may come with constipation or diarrhea, while inflammatory bowel disease will present with other symptoms, typically with bleeding, rectal or upper abdominal pain unresolved. So depending on the symptoms and the diagnosis, I would instruct the patient to undergo certain procedure. And usually for gastroenterological disease, we would advise the patient to do endoscopy procedure, such as esophagogastroduodenoscopy and also colonoscopy. Ultrasound abdomen and CT scan may be needed during the diagnosis process. Depending on the history from the patients, the symptoms and signs, and we have to follow through with proper examinations, I would come with certain probable diagnosis, and endoscopy procedure would help to determine the main cause. I will also need to order certain imaging procedure like ultrasound or CT scan in order to help the diagnosis. However, endoscopy will mean the main procedure that we perform day to day in order to achieve the diagnosis. The endoscopy is still the main procedure that we do for gastrointestinal disorder. However, the endoscopy methods, the endoscopy detections are becoming more and more precise. Then even now, there's also a possibility of using artificial intelligence in detecting certain conditions of the colon, for examples. And for imaging, we have all those newer techniques of CT scan and MRI, which would detect precisely where's the location of the lesions. There are certain tests which can do more precisely, like blood tests or certain stool tests, which determine the conditions more accurately. If we manage to achieve a proper diagnosis accurately and faster, we can plan the treatment protocol for the patient more precise and accurate. And because of that, we can achieve better resolutions or better remissions for the patient's conditions. We don't have to spend many months or days in order to arrive to the proper diagnosis. The procedure nowadays, especially the endoscopy, are more pain-free. It can be done under proper sedations, and the equipment are more accurate in a way that we can detect certain small lesions, especially for the colonoscopy. And the certain imaging like ultrasound, CT scan are more accurate and they are more precise. So we can arrive to a proper diagnosis faster. In gastroenterological condition, for example, if I can talk about colorectal carcinoma, it is important to do early screening, especially in a high-risk group. For example, if you have a family history of colon cancer, it is important for the children or for the siblings to have early detections. And once we detect the condition, the patient can be given a proper treatment. And in other words, it will prevent serious complications of the disease. Gastroenterology conditions needs early screening, and we can give a proper treatment early. Adopt a healthy lifestyle, because anything with gastrointestinal disorder can be related to our lifestyle. For example, excessive eating. We must have a proper lifestyle change modification, such as regular exercise, because those conditions may lead to multiple gastroenterological disorder. For example, if you had too much of certain food or too much of quantity, it may lead to reflux or gastritis. So it is important to educate the community, the patient, to have a healthy eating, proper exercise and regular timing and so on. That would prevent to develop into serious gastroenterological disease. I would advise on moderations on diets. We have multiple foods in Malaysia, so it's important to have moderations in what you take, and it's also important to have regular meals, and preferably do not have a late supper, because that will lead to multiple gastroenterological disorder. Exercise, yes, do regular exercise, but not in an excessive way, because that can also lead to stress and even probable gastritis. Lifestyle habit, try to maintain a healthy, positive lifestyle, because stress also can lead to gastritis, for example. All these actually are interlinked to each other, and if you manage to have a balance, you will not get gastroenterological disorder. Spicy food do not lead to gastritis. It is more of irritations. But however, it is advisable to have moderate meal, which includes spiciness or salty or sourness. But however, spiciness alone may not lead to gastritis. However, it is important to have a well-balanced diet in what you take.